My name is Raylan Panzica. This is my video essay for pharmacology. First, there will be two parts. First is the scenario with critical thinking questions, and then a research question. Starting with the critical thinking questions, it's based off a scenario. That is, EMS team has brought a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 from her cell phone after the woman screamed obscenities at her, then fell, seriously scraping her arm and face. The woman is bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell stale body odor and urine. So for the first critical thinking question of that scenario is, based on your first impressions of this patient's actions and appearance, what do you suspect she's suffering from? One, I think she is suffering from either substance or alcohol abuse. That can come from her wandering, not really aware where she's at from her altered mental status. And also her stating that she's needing a bottle. She may be going through withdrawals and starting to feel those symptoms. Another thing that I suspect is she has a mental illness that it has exacerbated, or that that's worsening, and she is not on a medication regimen, so she is having kind of an outbreak of that. Also, I do think that the patient might be homeless, suffering from homelessness because of the body odor and the urine that the healthcare personnel smelt on her. The second critical thinking question was, what short and long-term health risks would you suspect this patient to face? Short term, I just think that the 54-year-old woman will have very poor hygiene since she doesn't have access to get any personal self-care, malnourishment, be very thin, and her face being sunken in from lack of access to food, and also possible skin infections or urine infections from not being able to properly cleanse herself. Long-term effects of this could be from her mental health, or mental state and illness worsening, meaning she can become more delirious. She can also acquire anxiety and depression. Also, another long-term effect would be organ failure from excessive substance and alcohol use, like liver or kidney. Also, this a long-term effect could be chronic substance abuse and alcohol abuse, where this patient does not find any help for it. And also another long-term effect would be chronic homelessness, where which has to do with the chronic substance and alcohol abuse, which causes her not to be able to get her life back and be able to find a job, have a home. The third question is, why do you think the patient's hands are shaking, and what do you think causes her confusion and combativeness? I'm taking this from our Focus on Pharmacology book, written by Moni. I think this could be a symptom of delirium tremens, which these symptoms occur when people are long-term alcohol abusers, with the combativeness, the confusion, paranoia, or also I can think this is an exacerbation of her mental illness that she is having these symptoms. And the fourth question, what assessment do you think are needed for this patient? There is a quote from Phil Baker, who wrote the book Psychiatric and Mental Health in Nursing, The Craft of Caring, written in 2017, who has a quote about the definition of nursing assessment. The nursing assessment is mainly involved in clarifying our understanding of what is happening now, so that the nursing team might plan on how to respond in a way that meets the person's immediate needs. So with that being said, a nursing assessment should include a mental status examination, seeing what the patient knows, if they know where they're at, kind of getting where they're mentally at. The next would be a thorough physical exam, seeing if there's any wound, bruising, anything they need to put their attention to that could be another source of an infection possibly. Third would be obtaining labs, the CBC, CMP, and blood glucose. Those all can indicate like liver failure, kidney failure, Blood glucose could be one of the reasons that the patient is having some of the symptoms. Also want to get a urine analysis to see if that's a cause of infection. Also a drug screen and alcohol level to see exactly what the patient is on and how much. Another assessment the patient should have is social work and case management to come and assess them. The second part is the research question, which is mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it sufficient? What can make it better? So mental illness is managed by support, care, medication, or alternative methods of therapy like counseling, meditation, and that such sorts. Some examples of medications that are common are antidepressants, and from our book, Focus on Pharmacology by Moni, there are 3 common antidepressants categories that we use are tricyclic antidepressants, monoamine oxidase inhibitors, and selective serotonin reuptake inhibitors. So basically it's highly managed through medications that we know of. The support of insurance, we have an article by authors Creedon and Cook in the Health Affairs Journal in 2016. They wrote an article called Access to Mental Health Care Increased but Not for Substance Use While Disparities Remain. They talk about how the Affordable Care Act of 2019 and their expansion improved access to behavioral health in 3 different ways. The first way is the private health insurance made changes to their plans to make insurance more accessible to individuals and families who do not have employer-based coverage. The second way is expansion of Medicaid was designed to increase enrollment by raising the income threshold and eliminating other qualifications not related to income. And the third way was the ACA extended provisions to the Paul Whetstone and Pete Dementi Mental Health Parity and Addiction Equality Act of 2008, mandating parity between behavioral health and general medical insurance benefits across most sources of insurance coverage. Through this, they found through their research that overall it increased mental health treatment from the ACA mandated insurance expansion. Another way that's helpful is what I found is the Medical Health Care Act of 2017. There was an article written by 3 individuals from the Indian Journal of Psychiatry in 2019 titled Making the Most of Mental Health Care Act of 2017, Practitioner's Perspective. And they explained the Mental Health Care Act of 2017, which is rights-based and empowers the patients to make their own choices unless they become incapacitated due to mental illness. It ensures safer practice to psychiatry and will prove to be beneficial for the patients and psychiatrists. Generally, it's the doctors having to be able to document more efficiently as to what the treatment options are and why they are diagnosing the patient with this kind of treatment. But the question, is this sufficient? The authors Dixon, Holoshitz, and Nossel wrote an article in 2016 for the World Psychiatry Journal titled Treatment Engagement of Individuals Experiencing Mental Illness, a Review and Update. And they stated up to half of individuals with a serious mental illness had not received mental health treatment in the prior year. And this may lead to exacerbation of symptoms, rehospitalization, and not fully realizing the potential benefits of the treatment they could have get. From the prior Health Affairs Journal, Creedon and Cook, their reasoning for this was because of cost of care, and some of them had no insurance or they had inadequate insurance. So it is not as beneficial for the people who cannot be able to inherit insurance, so they do not really get sufficient amount of care. But the people who do have insurance, and they started making more treatment options for the insurance companies for people to more accessibly get treated, people are unaware of the change through their insurance, and they are not told anything else or provide any more information. And another reason is that there's not enough behavioral doctors and staff and facilities to be able to treat all the people that are needed get their behavioral health treatments. Another reason is stigma around mental health it's become recently better, but everyone everyone kind of generalizing that we should be able to take care of our mental health, and that it should be normalized to go see a therapist to limit exacerbations of mental illness. How we can make it better: people who do have insurance have that, be able to obtain that kind of knowledge, insurance should advertise it more and make it more accessible to know what they're actually getting covered for. I think another way to make it better is to help the homeless. I think homeless people are one of the top people to have mental illness and then treat it with substance or alcohol abuse. So they should be ones to be helped first. And also finding ways to be able to adequately cover everybody, people who don't have insurance, just to be able to ensure everyone's safety and everyone has the access to be able to be treated for their mental illness.